Well, good afternoon, everyone. It's Pete here from the Pain Toolkit, and yeah, yes, we are back on another Pain Toolkit Academy Q&A session, and you can see I've got Dave with me. We've got to give Dave a little bit of sympathy. Still struggling with a little bit of a cold from last week, but I know he's a bit of a soldier, so I know he'll soldier through. Yeah, here he goes, a little bit of a cough, and we got our good friend here, Grainne Daniels for all out there in Norfolk. And good afternoon to you, Grania.
Afternoon, Pete. Nice to speak to you both.
So listen, oh yeah, listen, we for those that may not know, Grania is part of our little bit of our team really, where we do conferences and stuff like that, and we'll like our little gang here, the gang of three, I call us. We got the we'll talk a little bit about it later on, but the conference coming up in the European Pain Self Management Conference in October. So, but I'll talk to you a little bit about that later on. But nice to have you on board, Gonu, and
Yeah, good to be here.
looking forward to hearing your answers. Really,
I'm really intrigued to hear what the questions are, so I always like this sort of.
yeah, yeah. Yeah, we've been getting some really juicy ones in for every day over over the last
Okay.
few weeks. So I'm going to go to question one, and they ask, what is the most substantial barrier you faced in promoting self-management practices among patients, and how did you overcome it?
Oh, that is a massive question, isn't it? Because
Super
it's,
massive.
um, I think if you try and, there's loads of different barriers, but I think if you really boil it down into anything and sort of try and distill it down to what the main issue is for each individual, is kind of in some ways a lack of confidence that they can actually do it. And through that lack of confidence, then that shows itself as either a fear of doing things by themselves, or a need to try and still understand what's going on, or to try and find a fix or a cure, or it's just a kind of a feeling, a sense that they're feeling overwhelmed by it and just sort of don't know where to start, or they're really
Mm.
brought down by it, low in mood. But if you really distill a lot of those things down into what the essence of it all is that people don't really necessarily believe that they can do self management themselves, or maybe even in some cases that they should do self management themselves, because we've all been brought up, especially in this country, in the UK, in many ways, to believe that healthcare
Mhm.
providers do the providing of healthcare for us, not so
Yeah,
much that
yeah,
we look after ourselves. And when that's distilled into our lives from an early age, it can lead to those barriers to kind of thinking, well, it's not, is it my job to look after myself, or is it other people's job? So
yeah,
there's lots of things there, but for me, the essence of it is a lack of confidence and understanding about what it really means.
yeah. I think for me, I mean, I've been doing it for quite a few years now, and the barriers are quite high, really. Um, Probably pole vault high, and I think people, as I did back in the day, I don't know about you, Dave, but we get so anchored into the medical model, and so I suppose it's our crutch, if you want to. I can't think of a better word at the moment, but we get so anchored into it.
Yeah.
When someone comes along and says to you about, let's try this and try that, it can seem a bit scary, like, it's like taking your first drive and that sort of thing, get a bit apprehensive. Whoa, what's going on here? Like, what, but so it can be that fear, and then say, as you mentioned, Gonya, that confidence is pretty low as well. Like, and sometimes, that saying, should I stick with the devil I know than the devil I don't know? Like,
Yeah.
but it's having a little bit of leap of faith, really. That, and I think really that, with myself and Dave and other self-managers, like, I think when they see us talking about, we know what it's like. We've been there, like, I think that's really makes things a little bit. What's the word in I'm trying to think of? What's the word I'm looking for, Dave? If I think if they see us doing it, where we've come from. Look, we know where we've been, where you are, but look, this is where we are now, like, but
It gives them a belief, perhaps, that it
yeah,
can be achieved.
yeah,
It's not. There is definitely something different between healthcare professionals telling you to self-manage and somebody who's lived through it telling you.
mm,
Although I do feel that ultimately the many times the person who's going to get somebody to start self-manage is going to be a healthcare professional if they do
yeah,
it the right way. So the final part of the question there was, how did I overcome those barriers? And the way I try to overcome it, and I'm not saying that I hit the right note every single time, depending on where somebody is in their journey, they might just not be ready to hear, I can sow seeds, but I can't necessarily make them grow.
mm,
But what I have to do is make sure that I validate people's experiences, make them
mm,
feel that they are believed and heard and seen and listened to, genuinely be interested and curious about them, and try and show that self-management isn't a negative thing. I think there's a school of sort of thought, or what is perceived is that when healthcare professionals are telling you to self-manage, it's a slightly negative thing, where we're going, well, this is it now, we've done everything we can do, you've just got to live with it.
yeah,
And that, even in that phrasing, it can be quite a negative way to say it, where actually it's about saying, do you know what, you would be surprised what tools you've got. We just need to help you figure out what ones work for you.
yeah,
And so reframing it as a more positive experience is really the way that healthcare professionals can shift that narrative for people, and move the goalposts a little bit, so that there isn't that focus on just what are you going to do, fix me, to actually perhaps a little bit more, how can you
mm,
help me figure out how to help myself. And that is where it's a freeing thing as a healthcare professional, because we're no longer being
that's
expected to
where
fix somebody.
that's where the Canadians come up with adding that word in it, it's supportive self-management. So, because I
Mm,
think that a lot of them felt they were being abandoned, like, you need to learn self-management, and people think, well, yeah, it's like saying to someone else, is go and drive this car without having any support, like. But what's Dave? What's your
Yeah, I
take on it before we move on to the next
yeah,
question?
I really liked something Grania said about, the patient might not be in the right headspace or at the right time in their journey to pick it up. So you sow the seeds.
Yeah,
mm,
And I think it's never too early to start sowing those seeds, because the germination and the growing, the initial sprouting will happen whilst the patient's away from you. But whilst you've got the patient there, just, keep sowing those seeds, keep saying, keep asking the patient what they could do to make their life better.
yeah,
Because what, as you taught me, Pete, when we're coaching, we're asking questions as opposed to telling people.
yeah,
mm,
And the medical model is very much, okay, we've done this, this is your next step.
yeah, mm,
Whereas if
yeah,
you turn around and go, look, we've done this, the next step is typically this. Do you feel that's going to work for you, or should we look at something different? And even if the patient goes, I don't know, I'll just follow your advice, you go with it. But at least
yeah,
you've asked the question,
mm,
and you started to sort of say to them, look, we value your opinion. Yes, we're the medical professional, but it's your body. You're living with it 24/7. So let's ask you what you think. And if you don't know, great, I can give you, we can follow my ideas.
mm,
But if you come up
mm,
with something, I'm always willing to listen.
yeah. Okay, thanks very much for that, guys. We're going to move on to the next one now. Maybe a little bit similar to that last one. I don't know, but can you share an example of a case where self-management significantly improved a patient's quality of life? Well, I'm a start. Well, I'll tell you what, myself and Dave, and I suppose I know you've had your fair share of stuff, Grainne, but I suppose, me and Dave sitting here, and our other buddy, Keith Meldrum, by the way, sorry he can't be with us again today. He's on vacation still. I don't know where he is now in Canada, but I know he's on some sort of road trip, but I hope he's well. Um, I suppose we're examples really of that, taking that leap, as what you were saying about him a minute ago, Dave, taking that leap of, I know when I'm in my I don't know, I suppose when I got to a point back in the day where I knew there was something else out there than other than pills and tests and stuff like that, and I suppose I hit a rock bottom, and I just knew there was something else out there that could help me without having to pop pills every bloody sorry about the language every day, like And I was lucky enough to bump into someone that knew about the pain management program at Input in London, and that was it. And I grabbed it. I was so in a corner. I knew it was my last chance saloon. I just grabbed it with both hands, and I wasn't going to let go of it, So, but Grainne, I know you because you're seeing people on a daily basis with, you know, where you're talking to people on a frequent basis about self-management and stuff like that. I mean, have you got any key sort of tips for your colleagues,
Well,
really?
like just thinking of, they want sort of examples of people because I think I could, I think what's really nice about you and Dave at the minute, especially and our friend Keith, is you are in essence very complete examples of the full journey to a degree. Albeit both of you probably still would say that you're still having every day to actively
Mm,
self-manage. You haven't
yeah.
finished the process, got your graduation medals, and then you don't have to do anything anymore. It's an active, ongoing process. But maybe what people might like to know about is when do you first start to see that? How do you, have you got any? I've got a few, I think, nice examples where just one little small change for somebody makes a big change to their overall quality of life. So there's a few examples of that I can think of. There's a gentleman who was really stuck feeling that he couldn't get back to. He was somebody who was a really avid runner, and he kind of felt if he couldn't run, that he couldn't do anything, and he couldn't
Mm,
self-manage himself because
mm,
what he wanted to do was to be able to run like he had run before, and his
mm,
chronic pain was not letting him do that. And
yeah.
then the first step for him in feeling that he was involved with his self-management was when we had sort of really sat down and explored a bit more about, well, what was it about running that did, what was it about running? What was it about that particular activity
Mm,
that he loved? And looking at what that did for him. And it was about just that sense of freedom and space and time to think and time to do things himself. And we, had a think about what other activities could he do that might give him that sense of that. And after a bit of time, it was him that came back to me the next time and said, well, I did used to like getting in the water, and actually swimming is sort of, there's a similarity there.
mhm,
And I think that maybe I could do that. But it was him that brought that to me. I didn't say to him, well, if you can't run, you should try swimming, because that would be me making that for him. But actually, he came back to me with the idea of thing. And then it was about, right, well, what do you think you could do to try and pace it? What would it look like if, what do you want to be able to achieve? What's realistic? Having those good conversations. And I suppose,
mm,
so the key thing within all of that was that my role, which is hard because as a physio, it's really tempting to go in and be a bit prescriptive and be a bit kind of, well, you could try this and you could try that and you could try anything else. So it's really tricky to sort of hold back and try and
mm,
encourage somebody else to come up with the way that they can do it. But that's the key thing that then gives somebody the confidence. And then 3 months later, I met him and he was swimming 3 times a week, and his
okay.
pain levels were pretty much the same, but he was feeling quite a lot different about himself,
Okay.
and his fitness was better.
Okay. Listen, before we go on to the next one, just need to before I forget, really, the three of us all were involved in the second pain self-management European, or what we would call it, the European Pain Self-Management Conference
Yeah,
on the 18th of
October.
October this year, and I'm really buzzing about it. I think we've got, as usual, we've got the mixture of healthcare professionals and self-managers. who are presenting. And what I'm really excited about this year is that we invited along the European Pain Federation, EFIC, and the British Pain Society to showcase what they do. They're going to do some 10-minute slots, just promoting really what they do. I think everybody's hear about that, gets to hear about them, but I don't think they perhaps they don't understand how they actually support not only just healthcare professionals, but how they're getting involved with patient education, etc. So I'm really buzzing over that. I'm quite excited, and they both agreed to do a couple of 10-minute presentations, So
Sorry,
anyway,
Pete, just to build on that and
yeah,
finish off the answers to the question, because of the way we run those conferences, there'll be three self-managers talking on there. So if you want to hear some other real life examples, straight from the horse's mouth, as it were,
yeah,
please register for the conference or, and if you can't make it,
yeah,
we'll send you a link to the recording
yeah,
afterwards.
yeah. It's donation only, and yeah. So we do the world one each February, but we was getting people saying, yeah, but I don't want to get up at 2 o'clock in the
Yeah,
morning.
that's always a challenge. What I would say for any healthcare professional that's watching these Q&As, or any healthcare professional that's thinking about it, we have a lot of things in our profession that's really important, and continuing professional development is one of them. And we often feel that continuing professional development has to be registered courses or big conferences with really high-end speakers,
Mm,
or
mm,
different things like that. And actually, CPD is just learning. It is learning, experiential learning. It's then reflecting on that, and that's why this sort of conference that we run, I think, is the most amazing source of continuing professional development for any clinician of any background,
mm,
medical, allied health professional, anything else, because you've got 3 hours, different speakers, lived experience, and it's practical, demonstrable stuff that people are doing and talking about. And actually, then CPD is supposed to be all about what you might do to change your practice. So to go away then and reflect on that and think what one little thing, of which there's bound to be at least one little thing that people can take then and change in their own practice. And it's so low cost, such good value for money, and such a really great way to have that little bit of continuing professional development with no high costs trying to get to conferences abroad, or trying to register, having to do hotels, trains, take time off work. You don't even have to do the conference live, although I would recommend people, if they do registering, trying where possible to attend on the day, because that's your opportunity to ask
yeah,
people questions and engage one-to-one with these people, which again you just don't get at
yeah,
a
yeah.
large conference. So that would be my plug for it.
Can I just throw something in before we go to the next question?
Mm-hmm.
It's something that's sort of has been in the last 24 hours, 24, 36 hours. It's sort of kicked off on social media. And I think I posted, I'm not sure it was me or someone else posted about um, information for patients. And Shana from Canada, she's an OT over there in near Oregon. Is that Canada? It is Canada.
No, Oregon, I think, is Northwest America.
Okay. Oh, okay. Yeah, I'm getting. We'll have a chat for
I
a sec
think, but
anyway.
like, hopefully nobody will catch me up on
Anyway,
that.
she's over that way, and she was saying about the information healthcare. See, oh yeah, what it was, I saw a video. I saw some videos yesterday afternoon, and the way and I think to myself, this is great information, but it's very technical,
Mm.
And anyway, I didn't expect any feedback on it, but Shana made a comment about that we healthcare professionals need to be mindful or conscious that people's reading age, and then she said that the reading age for for most people was sixth grade, and I had to look it up, and it's between 12 and I think it's 12 years old, and then another lady, I can't remember her name now. We should. Oh, Anne from the UK. She said it's between 9 and 11, and that she was Anne today. She's putting a comment on the Facebook, Paint Toolkit Facebook page. She said that a lot of the information, the written information, is like A-level standard. You know,
Mm.
I haven't got any A levels. I haven't got any level. I've got a spirit level.
There's
And
definitely I see that quite often as a real one of the it's a different barrier, but it can be a barrier um to working with people because yeah, there was a lot of assumptions made by
yeah,
um healthcare professionals who, let's face it, will all have been educated to a usually an undergraduate level. You know, they will have
yeah,
attended university, so therefore their reading level, writing level, comprehension level will be at a certain amount, and it's really easy to forget that
yeah,
people. You have to really make sure the Kieran O'Sullivan test, isn't it? We like that, where you have to check back with people that they actually understood what you were saying to them and what you meant by it, which is really important.
okay. We've got room for one more question, and
Absolutely.
I'm going to end on a. There was a couple there about wearables and stuff like. But I'm really digging this last question that was on the list. And they said, imagine you are a host of a dinner party where three prominent figures in healthcare. Yeah, imagine you are a host of a dinner party with three prominent figures in healthcare. Who would you invite? And what would you discuss regarding self-management?
Oh, um, well, if there's a few people that I would invite. It's going to be a little bit sort of physio heavy, just because of some biases of mine.
Yeah,
Um, uh, I would invite one person I would love to invite, and unfortunately he is no longer with us, so I can't invite him. Would be Louis Gifford, who was a physiotherapist who was in many ways very ahead of his time, and sadly passed away. I think probably nearly 15 or maybe even 20 years ago.
yeah,
I was fortunate enough to meet him at a course, but I was a very young, newly qualified physio, so didn't really get the opportunity to actually talk to him. I was being taught by him. Um, but he had a really innate understanding of the importance of working with an individual, helping them to understand what was going on, and really talking about self-management, but not necessarily in the way that we understand it now. So I'd really love to be
mm,
able to talk to him and see what he thinks about how we talk about it now, all of the advances that have come about, all the new understanding about pain science and neuroscience and brain science that has all come about since he sadly passed away. Because I think he was a visionary and we lost him far too soon. So I'd love to be able to have him there. Um, I think,
While you're thinking, can I ask Dave so you can have another think?
yeah,
Dave,
I'm
anybody?
not really au fait on who's who in the medical world because I've tried to steer clear of that, and I haven't. Some of the people that we've had on to these talks would be good because they're into it.
Who and what one? I know they've all been good, Dave, but is anyone you would like to invite to our dinner party?
Probably Virginia, who I missed last week,
Hmm.
just because of one of the talks she gave on one of the conferences. I thought she really got it. The other person I would do would be the another one from this one from New Zealand. I'm forgetting his name. Is the doctor that's doing all the work with the indigenous population out there.
Oh, Hem Dev.
Yeah. So I think those two would be a good start. And then I'd probably bring someone like Dr. Fauci from the COVID time in, just to get someone that's purely in the medical because he did an amazing job on the US side, appears to, from, the side of the pond. And it just seemed like he had a very pragmatic and practical approach to medicine and the managing of the pandemic from that perspective. So it would be quite good to get his perspective alongside people that are working in the pain space to see how someone as a chief medical officer could, start to push the
self-management. That's
The
it.
benefits of it, yeah.
Yeah,
From a position ultimately of power.
yeah, good
What
show.
about you, Pete? Who would you invite?
Uh, I tell you, he inspired. I say inspired. Well, my first one really would be Amanda Williams
I was going to. I
because
thought she might be in there.
yeah, because Amanda was she came along and spoke to. That's how I got on the program. Really, she came along to the back pain support group and talked to the group about the back pain support group I was running back in the day. I think it's about '94, and yeah, so I definitely invite her. And she, I mean, without her, we'll be sitting here talking to you guys, like you know. I think the other one would be Lorimer Moseley.
Yeah, he would have been on
Uh,
my list because you're going to have a good dinner party with Lorimer
yeah,
there. He can
um, I met
tell a
him. I heard
story.
him speak at. I was over in Istanbul, and I looked at this dude like, and he had a like an Hawaiian shirt on and flip flops, or in Australia they call them thongs. And I'm looking at this dude and I'm saying, you know, you think, well, it was, you know, I just, you know, when you take the people thinking, you know, because he's ticking all my boxes, like, you know, and I hadn't been, I suppose, I can't remember now how many years I was into recovery, but he was ticking all my boxes, like, you know. Grania, what's your last two?
Well, my last, I would like to invite somebody who I haven't had much opportunity to connect with in recent times, but who, along with you, Pete, was sort of my real first introduction into people who have lived experience who've really taken the mantle of self-management from it, and that would be the lovely Jo Belton from Colorado, because I think she has, again, while she's taken it and doing self-management and running with it and applying it
Mm,
to her life, she's also taken up the mantle like you have of kind of trying to understand more about it and really trying to work to help healthcare professionals and others, a bit like yourself and Keith have done. And she's
yeah,
always somebody that I'd love to have at a dinner party.
yeah. Anyone else?
Um, I think if I was going to, it's going a bit lower key, but it's somebody who taught me an immense amount when I already thought I suppose I already kind of thought I knew lots about self-management and lots about what I did because I went into a job as a clinical lead in a service, and I thought, well, they've hired me because I know my onions and I know lots of things to do. And we hired a clinical psychologist who'd never worked specifically in pain or self-management before, but we had her to speak on the last European conference, my lovely colleague, Dr. Lizzie Doher. Um, but she just got it. She got
Yeah,
it really quickly. She really understood what
yeah,
supporting people to self-manage was all about. And she applied these amazing psychological skills to adapting pain management programs and kind of just tweaking all of the stuff that we had been doing for years and getting results then out of that were so much more empowering and so much more effective just by slightly tweaking because she just really got it, and she's
yeah.
a fabulous company as well.
I think to close on, I think my one is, I mean, there's so many over the years. Um, is Paul Watson, physiotherapist. He's retired now, but I met him. Lucky enough, I met him last year when he was over this way. He was doing some bell ringing business, one of the local churches and stuff. We caught up then, but back in the day, I suppose when I was wanting to learn more, I had this massive thirst for pain management, etc. And he used to do um, like little workshops with his buddy Chris Main, um, uh, and I used to go there and I sit there and I was lapping it up, mate, you know, and I didn't. I remember going up to him during a break, like you know. I remember he was sitting on the floor having some food or something. I went up to him. I said, "I know you don't know me," I said, "but I'm Pete Moore, da 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 da, and I don't want to interrupt you with your break and everything. You're busy, and you know, but I'm really good at really digging what you say, like you know. Even when I met him last year, like you know, I mean, it was." You know, he was saying things to me, it sort of rejuvenated, but put a lot of wind in my sails, like, you know. But yeah, so yeah, Paul has been quite instrumental. And I always like him and Chris May, and always quite enjoyed hearing them, like, but
Yeah.
kind of interesting fellas, like, But hey, listen, there's loads of them out there, There's lots of. Hey, what about? Let's give that other lady a shout. What was that lady you recommended? So the Lauren Connell last year.
Lauren Cannell, yeah, she was
Yeah, so that lady, she
lovely.
was quite inspiring. We saw her on that YouTube thing, and came along and told her story. But there's so many fantastic people out there.
Well, you've got Helen Groom and
Oh God, yeah, got there.
you know that there are so many
I
amazing.
know, Helen Room and all our
And
buddies.
if anybody wants to see our amazing dinner party list, really go back over all of the conferences that we've run, the
Yeah,
European ones, the
yeah,
Australian ones. I'm sure if people reached out to you with a small donation, you could arrange to sell them, to send them on the links to
yeah. Well, I don't. Yeah, I'll
past
send them the
things.
links. Yeah, yeah. I mean,
Because actually, all of the
well,
reason why we pick the people that we do to talk at the conferences, we talk a lot about it. We go kind of, what are we trying to achieve? Who do we want to speak to? Half the time, it's people that have inspired us by the way they've been, and then half the time, it's
yeah,
somebody else has been inspired by them, and we look them up, like
yeah,
Lauren, kind of go, wow, yeah, I want to learn more. So they're all people. Anybody that we've had on are people who we are kind of inspired by, and therefore, by definition, we would probably love to have them at the dinner
yeah.
party. So yeah,
Well,
reach out and ask
yeah,
Pete for a small donation to get the links to previous conferences, and you'll
yeah,
see
yeah,
exactly who our dinner party guests would be.
yeah. Great question. I don't know who said that in, but Edison, we're going to wrap things up there tomorrow. We're with Katie Napson, who helps start up the Pain Toolkit Academy. So I'm about to be looking forward to that one. And on Wednesday, we are doing one. I don't know if you know. Do you know that about that one, Dave? Tom Bowen, May
Yes, I
Thursday.
do at
Yeah,
5:30 on Wednesday.
yeah, something like that. Anyway, but they're coming in thick and fast, and they want to. In fact, it's like I'm like you, Grainne. I bet you want to come back and do some more there, because I don't know about you, well, me and Dave. We say every week, like, we really love doing them, like, because see, it just seems to go so quickly, but it's a 30 minutes of good time, like,
Yeah.
But a
Yeah.
lot of the previous guests we've had, they said, when can I come back?
Mm.
So anyway,
Oh
we'll
yeah.
see how that goes. Anyway, thanks everybody. Thank you, Grainne, for joining us. By the way, if I forgot, what are you doing up? What are you up to now, work-wise?
So I have three things that I do actually. So I still work for our uh, local acute trust chronic pain service. My role there is to sort of assess people coming in new into the service and hopefully provide a supportive environment for them to kind of understand what pain service is about, what we can offer, and how we can, right from that very first appointment, put self-management alongside any other treatment at the core of it, because that's really key.
Mm,
As Dave
mm,
said before, it's never too early to start talking about self-management, even alongside other things. I do have my own private practice, so I can do some supported self-management coaching with individual clients. But I also work as a case manager, so I support and help people to recover from acute orthopedic injuries and help them to access treatment. But again, what's really nice about that is I can use my skills to kind of really encourage them to be an active part of that recovery. Again, not just what other people are doing for them, but what they can do for themselves.
Well, thanks very much, Dave. Thanks very much. I know you're still a bit under the weather, but it's much appreciated. So we'll see you again on another Pain Talk Academy Q&A. Take care. Look after yourself. Adios. Ciao.